Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon, or should I say still good morning to some of you.
Waalaikumsalam warahmatullahi wabarakatuh. Salam Jumaat.
Salam Jumaat semuanya. Okay, so let's just give a couple of minutes to allow people to come in, join us, our live session. Welcome to the live session for MAA Medicare Kidney Charity Fund. You're now with me, Nani Roslan. I'm the moderator for today. So before we begin, please share this live right now. Share in your Facebook. Share lah kalau rasa video live ini akan memberi manfaat to your family, to your friends. Share, because who knows, you will be the lucky winner to win a deluxe healthcare package that is worth 290 ringgit. So if you have heard of us, give us a thumbs up. If you haven't heard of us, share. So share now before we begin, because today we'll be talking about COVID-19 and kidney disease with our doctor today. Before I introduce our panel today, again, share, jangan lupa share. So we have already picking up viewers. Okay, hello everyone. Good morning, selamat tengah hari. Okay, so allow me first to give a brief background of MAA Medicare Kidney Charity Fund. Now, MMKCF was established in 1994, and it was established for needy kidney patients to provide them with high quality medical hemodialysis care. So over the years, MMKCF has gone beyond providing basic dialysis treatments and it is actually the second largest non-profit provider in Malaysia, providing highly subsidized treatments and care to over 790 patients at its 11 centers nationwide. Banyak centers too. And MMKCF's effort have benefited thousands of kidney patients nationwide via its subsidized hemodialysis treatment and its many extended services, macam counseling, dietary and nutritional advice, health checks, transportation, and monthly grocery supplies pun ada juga. And apart from this assistance, MMKCF also subsidized treatment costs for its patients' blood tests, medication, and EPO injections, costing approximately 3 million annually. Banyak. Memang lah kan, healthcare is not cheap. So that is why MMKCF comes in and help all the needy Malaysians, especially for kidney patients. Okay, so okay, thank you so much. Oh, ada orang komen, Doktor, handsome Doktor hari ni. Okay, I think that's the cue to introduce our panel today. So today we have Dr. Mohammad Shazli bin Abdul Rahman. He is a medical officer for kidney operations, MAA Medicare Kidney Charity Fund. Hi, Doctor. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
How are
Thank you for having me. I'm doing well. Thank you very much.
Terkejut, Doktor. Ada orang kata Doktor handsome hari ni.
Oh, thank you.
Okay,
It's a jacket.
It's a jacket. I think it's a jacket. Okay, Doctor. So we'll just go straight to it, to the discussion today. So Doctor, maybe you can explain to our viewers today, what is actually kidney disease, Doctor?
Okay. So basically, in a nutshell, the kidney is supposed to clean your blood. Okay, so it's supposed to purify your blood and then remove all the toxin, and then it creates the urine. So when you pass urine, you're actually removing all the toxic. So what we learned in Form 5, Form 4 is the perkumuhan and all that. So all the waste goes out. So what happens is when you develop kidney disease, okay, there is damage to the kidneys and they are unable to filter the blood efficiently. Okay, so then to the point that if it doesn't get treated, the damage can become permanent. And then when it's permanent, the kidneys no longer filter the blood, and then you actually need to undergo treatment such as hemodialysis or. So basically, we divide kidney disease into two: acute renal failure and then chronic renal failure. So acute usually happens within a few days, like 3 to 4 days. So for example, it can be from infection, it can be from dehydration, it can be from injury. But at least acute, it can be reversed. That means if you get early treatment, it can go back to normal, all right? However, if you have chronic kidney disease, for example, the acute, you don't get treatment, you don't go to the hospital, whatever it is, so the acute can change to chronic, and then the chronic can eventually cease the operations of the kidneys altogether, and then your kidneys don't work anymore. All right, so that's where you need to actually make sure if you have any symptoms, you need to get yourself checked because unfortunately for kidney disease, there's no early signs. So you don't get early signs of kidney disease. You'll get it later. That means by the time the person reaches chronic, barulah ada symptom macam mata bengkak ke ataupun muntah ke and all that. But there are 5 stages. So stage 1, stage 3 is acute. Stage 4 to stage 5 is chronic. Stage 5 tu dah masuk end stage. So stage 1 to 3 tu no symptoms. You'll be perfect. You'll be happy. You'll be jumping all the way. Stage 4, stage 5 tu barulah rasa letih lemak. So by the time the stage 4, stage 5, it's a bit too late. So that's why we advocate patients, rakyat tu, to when you reach 30 years old to do annual checkups for your kidney profile and all that. So at least from there, we can actually see the early changes in the kidney function otherwise.
So that's why I think for our viewers today, it's important for you to share this live today. Sebab apa? If you share, you will stand a chance to win a deluxe healthcare package worth RM290 yang ada this kidney profiling. Betul tak, Doktor?
That's right.
It is
There's a kidney
included.
profile. Yes.
Right. So, like Doctor said, 30 years old, I dah lepas lah. I memang dah kena dah ni. I'm at that age now.
Yeah, at least once a year.
To check. At least once a year. Okay.
Yeah,
So dah 4
check,
tahun dah tak check. Okay. So Doctor, meaning to say that there's no symptom at all for acute, and usually people come in to the center tu memang usually dah chronic dah lah, Doctor.
Yes. So we always get our patients, majority sometimes of acute, of course, it can be due to infection or that. So you get fever, but they don't present with obvious symptoms. So by the time they come to us with very severe ones, that is obvious, usually it's already stage 4 to stage 5. So that's why we say, don't wait until you get symptoms. Check regularly your kidney profile. Then from there we can see whether the creatinine is increasing or the urea is increasing. Then we can make more tests like an ultrasound to determine the function and the structure of the kidney as well.
Okay. All right, Doctor. So coming back to our discussion today about COVID-19 and kidney disease. So for example, for a kidney, for a patient with a kidney disease, are they more at risk of getting COVID-19 than somebody who doesn't have kidney disease, Doctor?
All right. Basically, COVID-19 right now, the infection is quite rampant. The knowledge with regards to COVID-19 is still in its infancy. So many doctors are still doing research. Okay, but with regards to the question, actually, it doesn't affect certain people. Basically, it doesn't target certain people. It affects everyone the same. All right, so I think Dr. Nick mentioned this before in the previous interview. COVID-19 doesn't discriminate. All right,
that's
so
right.
It will infect any age group, healthy or the ill, any race group as well. So siapa sahaja dia akan kena juga. So it doesn't mean that if you have kidney disease, you are easier to contract it. Right? It's the same for everyone. Okay, but the only issue is the infection. Okay, so it's the consequence that we worry about, because those who are healthy without any other medical problems, they can actually recover from COVID-19. But those with chronic illnesses like such a heart disease or even kidney disease, they can suffer the complications of COVID, which can make it worse, and they can actually pass away because of it. Okay, but however, it affects everyone equally.
Everyone, right. It doesn't discriminate. COVID ni jahat, betul dia. Okay, so but having said that, do they still have the risk of developing severe COVID-19 symptoms? For kidney patients, sama juga ke tak the symptoms tu, Doctor?
Yes. All right. So when it comes to symptoms, the early symptoms, it might be similar. Okay. Sometimes they even don't have any symptoms, asymptomatic. Okay. But then when they do develop, it can still be your usual fever, cough, sore throat. Okay. The thing is for those with end-stage renal failure, because when they have kidney disease that's already terminal, the immune system is very low. Okay, so they don't have the ability to mount a defense against this virus.
Right.
Okay, so for those who are healthy, they're able to fight it. But those with this chronic disease, the infection can actually get worse. Okay, it can actually spread throughout the whole body and aim for the lungs. So basically, they will start to develop severe symptoms. And these severe symptoms will eventually invade the lungs, infect the lungs, infect the kidneys and all that. And they will actually deteriorate very, very quickly, especially the one with the new Delta variant that's around. But because of their low immune system caused by the end-stage renal failure, their symptoms can get worse very quickly. That's why we need them to prevent them from getting COVID in the first place. That's number one. And then number two, when they do get the COVID, they have to seek treatment early from his control doctor.
Okay, speaking of prevention, burning question now lah, doctor. Can kidney patient take COVID-19 vaccination?
Yes, of course. Yes,
please.
they can. Please. Actually, if you notice, the government has made a few phases for vaccination. Like phase 1 is for frontliners, phase 2 is for those with medical problems. The aim of the vaccine is actually to protect those who are ill, with heart disease, with kidney problems, diabetes, hypertension, because these are the ones who are prone to actually get complications from COVID. So these are the ones that we advocate for the vaccine. So if you do have COVID-19, there's no contraindication. You can take the vaccine and you should take the vaccine. Please do.
Okay, so for patients who are undergoing dialysis sessions, can they take vaccination at the same time they do dialysis sessions together? Ada any adverse side effect? Boleh je.
Okay, the common side effects for most of our vaccines, whether it's Pfizer or whether it's Sinovac or AstraZeneca, is actually fever. Okay, fever and then maybe pain at the injection site and all that. So it's safe. You can actually undergo dialysis. Okay. It's just that we only advise those who already did a dialysis, let's say on the same day of the vaccination, because in the machine, we actually put heparin, which is to actually dilute the blood a bit, so it doesn't clot. Okay, so the only advice we say is after you inject yourself with the vaccine at the centers, just apply pressure for at least 20 minutes. Itu saja.
Oh, because tak nak the darah.
Darah tu boleh keluar sebab dia cair kan.
Right.
But otherwise, boleh, tak ada masalah. Itu saja.
Even better lah, doctors. But they say that, some effects of vaccination kan blood clot. Okay lah tu.
Yes. So
in a way.
For AZ, it's very, 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 very low, 0.005%. Okay?
Lagi lah lower than this.
Lower than that, okay? but otherwise, I think maybe many patients are worried about fever, so they do get fever after the injection. So you can actually take Panadol to control the fever.
Not a problem.
Yes.
Okay.
So if you are okay, fever is controlled, blood pressure is okay, they can undergo dialysis as usual. No problem.
Okay. All right. So still a question about dialysis treatment. Can COVID-19 patient be denied dialysis treatment if they are infected with COVID? Lepas tu dia nak buat dialysis. Can they be denied?
No, they will not be denied. Okay, but we do have certain protocols provided by the Ministry of Health. It's called Annex 28 for COVID-19 hemodialysis centers. We have to make sure that number one, if they are positive with COVID, we try to avoid them from actually contaminating the center. But we have to make sure that we will set out a place where they can continue their dialysis. Okay, so most of the time they will be referred to a tertiary hospital. Okay, for example, like over here, we refer them to HKL. In the hospital Kuala Lumpur, we actually take them in, admit them in the ward, nephrology ward, and then they will undergo dialysis there until they complete their 10 days so-called treatment there.
Okay.
So once they're done there, then they can actually return back to the dialysis center. Otherwise, because we have to give and take. So if we do allow them to enter the center, because our centers are not built to actually have an isolation area, they can spread the COVID to other patients in the center as well. Okay, so we don't say we don't deny, we actually say, okay, wait until your COVID is cleared, then we will allow in, but we will help you to find another place to continue your dialysis.
Because so whatever it is, they cannot skip.
They cannot skip. Dialysis is done every time it's done is 4 hours, and then it's done 3 times a week, and it's done for the rest of their lives until they get a kidney transplant lah. Otherwise, so they have to continue it. So we've been licensing with government hospitals, private hospitals as well, where we can actually outsource these patients for COVID-19 dialysis. Once they're well, they come back to us. So we can. They're not denied. We will help them otherwise.
Great. Yang penting, don't skip dialysis.
Yeah.
Okay.
We've even had occasions where we send our nurses to their house, because when they say they're positive, they don't want to go anywhere. So they actually stay in the house. They don't go for any sort of treatment. Dialysis pun they want skip. So they become very, very swollen. So we will send our nurses to their house, like home visit, and then we will tell them, ask them, are you okay? What's wrong? Okay, then they'll say they're COVID. Then we will quickly get the ball rolling, get the referral letters, get the ambulance, all that too. Then we will send them dialysis in a COVID-19 center.
Right. So that's why it's stated that counseling is also a part of the service, because counseling for K patients are very important, kan, Doctor?
Correct, that's right.
Oh, okay. So just to quickly reset the room, for those of you who have just joined us, welcome. Thank you so much for joining our MAA Medicare Charitable Foundation live. Today we're speaking with Dr. Mohammad Shazli, our handsome doctor today. Bukan saya cakap, viewers yang cakap. So today we are talking about COVID-19 and kidney disease. Oh, thank you so much for the thumbs up, for the love. Please keep on sharing this live session today, because you can stand a chance to win a deluxe healthcare package, which is worth 290 ringgit. So this package it's comprises of blood tests, which will provide you with kidney profiling, kidney profile, cholesterol profile, and banyak lagi lah, and also doctor consultation. So it's really important. Just to recap a bit, Dr. Shazli had mentioned tadi, it's very important for you to get your kidney checked before it becomes detected as a chronic kidney disease. Manalah tahu kan, touch wood, we don't want to be kita panggil apa, AKI doktor, acute
kidney infection,
because there's no symptom for that, right? Okay, so again, a bit of a recap juga for those who have just joined us. For kidney patients, don't skip your dialysis treatments. Don't skip your dialysis treatments. Yes, betul. Try dialysis treatments, and also please get yourself vaccinated. Okay, coming back to the discussion, doctor. This one is also sort of like a sensational topic juga lah, because I see that there's a lot of research coming in. So can COVID-19 cause kidney failure? Because I've read a new research, COVID-19 cause AKI, or acute kidney infection. So doctor, how far is that true lah?
Okay, so basically what happens when the COVID-19 infects someone, one of the things that it does is actually it thickens the blood. So when it thickens the blood, it tends to clot easily. Okay, so when it clots easily, it can actually block certain vessels. It can block vessels of the heart. It can block vessels of the kidney as well. So initially, when COVID first came out, they didn't know about this, so they thought it was more of a lung infection, like the initial SARS before COVID came out. But this virus is much more advanced. It's more complicated. So what they discovered is whoever gets admitted for COVID, are discharged, they don't just have a residual lung problem, but they develop acute renal infection or acute renal failure. So after they've been doing research, they found out that the blood supply to the kidney sometimes is actually blocked by a clot of blood, which is actually caused by the COVID-19 infection. Okay, so there are a few research like this by the Mayo Clinic and all that, stating that maybe about 10 or 15% of patients who do develop COVID-19 infection, they will actually be discharged with some mild to moderate kidney failure. Okay, so when they notice that, that's where they start to take treatment to prevent this acute infection from becoming chronic. So there is truth to that. There is indication where COVID can directly cause acute renal failure because of this blood clots. However, majority of the time that patients do develop either acute to chronic is because when they end up with a severe infection and they end up being in ICU, they intubated with the
right.
ventilator in ICU, then the oxygen levels drop dramatically. For example, our blood oxygen should be about 95%. Theirs can drop below 50. So when it
It's
drops
very
below
low.
50, despite all the oxygen being through the
Yeah.
mouth, nose, and all that, the body's response is to actually try to save the brain. So it will cut blood supply to other organs, they
I
cut supply to the
see.
liver, the kidneys and all that. Why they want to preserve the brain. So basically what we call it is multi-organ failure. So when they get multi-organ failure, they can actually develop acute to chronic renal disease and can also progress to chronic as well. So basically COVID can cause two ways.
Right.
Blood clots causing the blockage of the kidney, or multi-organ failure when the patient is very severe and is admitted into ICU. So this
Right.
can worsen those with worsen or cause kidney failure.
Okay. Well, so that is really a scary thought, actually.
Yes.
So that's why, again, hopefully that we will reach herd immunity.
Yes.
Hopefully that everyone will get vaccinated. So, because COVID is very ganas lah, kan? Especially this variant Delta.
The worrying thing about this COVID-19 is it actually learns from us. So, for example, initially it was the alpha and the beta and all that.
Yeah.
So after the virus infected so many people, and then we've been trying to create vaccines to counter it, or our immune system is trying to counter the infection, these viruses will actually start to mutate. So when they mutate, they learn about what we're trying to do. So the variant becomes much more stronger, much more aggressive, okay? And then it can cause even more severe infections. So that's why actually it was just the lungs. Now we discovered that it can also infect the kidneys as well. More or less in the future, we might even discover that it can infect the liver, or it can infect the brain, it can cause some meningitis and all that. So we don't know because it's still early in the pandemic. So anything can happen in the future. So that's why, like you mentioned, if we can get herd immunity and we can prevent the virus from mutating, then we can stop it in its tracks. So it's basically a race against time, So by the time we vaccinate, let's say 90% of the whole world, but it takes 5 years to do it. 5 years, then the thing dah mutate jadi variant.
Benda lain pula.
Then the vaccine yang kita ambil tu most likely did not cover for that particular variant.
Yeah, that's right.
So kena cucuk lah booster pula, So it's an ongoing battle. So the frontliners and the doctors and the researchers are having a lot on their hands at the moment.
That's right. Yeah. Okay, so doctor, coming back to our discussion, can dialysis patients recover from COVID-19?
Yes. We've had a few patients who were infected with COVID, and then we referred them very, very quickly to the hospital, and they got treatment. So those who detect early, undergo treatment early, we were able to save them. So we were able to reverse the infection. They recovered and they did not worsen the kidney disease or anything else. So yes, if you detect it early, we can provide the treatment adequately. However, if they are detected late, all right, so by the time they reach the hospital, there's so much the doctors can do. Okay, so they will do their best to try to alleviate the infection. But sometimes once the infection has already propagated throughout the whole body, together with the complications of kidney disease and the low immune system, it's difficult to save the patient. So I'm sad to say that from my practice, we have seen patients who develop, for example, symptoms on Monday and then confirm COVID-19 on Monday, and they even pass away on Tuesday. Sometimes it takes 1 day.
That quick.
Get quick. But then when we correct the history, when we ask, okay, what happened? Also, actually on Friday they already felt unwell.
Right.
Friday, then Saturday felt some bone aches, and then Sunday felt some a bit feverish, but they said, oh, it's nothing like, it's just your, your money. Then Monday they got worse, so that's why we thought, oh, it could have started on Friday itself. So if, let's say, the patient was referred on a Friday, there could be a possibility that the doctors could have saved the patient otherwise.
Right,
so yes, they could. Yes, COVID-19 infection to end-stage renal failure patients, if they are caught early, and the treatment is adequate, okay, they can be treated. They can be treated.
Okay. At least there's a silver lining lah.
That's
But
right.
yeah, another this is a question is quite tak best sikit lah question ni, tapi we have to ask juga. So are people with kidney failure more likely to die of COVID-19 than those without?
Unfortunately, yes. Unfortunately. Okay,
Okay.
like I mentioned before, if it's a healthy person without other medical problems, they have a higher chance of survival. But if they do have other chronic medical illnesses, such as kidney disease, heart disease, or uncontrolled diabetes or hypertension, the body itself is already weakened by the disease, okay, and their immune system is also weakened by the disease as well, by the kidney disease. So when the infection takes over, they are unable to counter the virus infection because there's no antiviral or antibiotic for COVID-19. So we rely 100% on our own immune system. Just like dengue, when patients get dengue, we don't have an anti-dengue antibiotic or antiviral. You know? We just give them fluids, we monitor their blood. Eventually, the patient's body's immune system will fight the dengue infection. Same goes for COVID-19 as well. So if the immune system is already compromised by many diseases, therefore they will have difficulty, the body will have difficulty to fight the COVID-19 virus infection. That's why we always advise our patients to always maintain normalcy with regards to all your diseases, meaning that your hypertension is controlled, your diabetes is controlled, you know. So when you do that, the immune system has a chance. Okay, but if your sugars are all uncontrolled, your hypertension is skyrocket over the roof, your immune system will be weakened. That will compromise the possibility of survival. So unfortunately, yes, your question for those with chronic illnesses, they tend to be
there's
a
a risk
case.
there lah.
That's right.
But are there any additional measures that patients can take to limit the risk of getting sick, especially when they undergo dialysis, doctor? Sebab dialysis kan, as we know, it will really lagi weaken the immune system, everything jadi penat, letih. So any other additional measures?
Yeah. Basically, right now, we are advocating what the COVID-19 protocol for MOH. So it's all about following the standard operating procedure for COVID-19 infection control. So the main idea is to actually maintain social distancing, okay, among your other colleagues or other patients in the center, even at home as well, you know, because we realize that some of our patients bring the COVID from home, not from the center, okay, and then they always have to wear their face masks, okay. So we advocate nowadays to wear double layer. So your first layer will be your normal mask, and then your other outer layer will be the cloth, okay? But best if they can get the N95, KN95 mask as well, and to protect themselves with the face shield, right? Nowadays, it's best to carry along with them, the patients, hand sanitizers that you can actually put in your bag. So knowing that a medical center, whether it's a hospital, clinic, or a dialysis center, there are always bacteria and viruses all over the place. So whatever we touch, we don't know what it is. So best for them to actually sanitize their hand often.
All the time,
But we always advocate to our patients who undergo dialysis is to always take your medications to control your hypertension, your diabetes, your cholesterol, and all that, or your calcium and all things. And then to always control their protein and salt intake, and then their fluid intake. So in a sense, they have to be stable. If they're stable, their chances of getting infection, maybe the immune system can counter. If they do get infected, they can fight it, okay? But we have a lot of patients where their condition is not stable. They'll be coming with a BP of 200 over 150, sugars of 22, and then we go, "Pakcik, tak makan ubat ke? Apa malam makan durian, you know, so so they have to be stable, you know, so they have to comply to the medication, diet control and all that. So once the BP sugar is all controlled, the immune system is optimized otherwise. Okay? So this is what they can do to prepare themselves to try to protect themselves from getting the COVID-19.
Right. Just to manage the risk.
Yes.
And are those the same advices you would give if a person asks you to manage the kidney disease if they are infected with COVID-19, doctor?
Yes. more or less, if they're already infected with COVID-19,
Yeah.
okay, so they may suffer the so-called symptoms of a full blast COVID-19 infection. So even more further, they really have to manage their diseases. Okay, that's why sometimes we need the hospital's help. So when they are admitted in the hospital, the doctors can monitor them very, very closely. So sugars every 6 hours, and all that. So the close monitoring itself can help them to control all these other diseases, giving a chance for the immune system to counter the virus itself. So more or less the same advice, but I think with COVID infection for a kidney disease patient, they might need a bit of help. So they may need the help from the medical facility. Okay, if they're asymptomatic, sometimes we give them the HSO, the home observation order. Okay, home surveillance order, but they will still have to come to the dialysis center. So when they do come to us, most of the times our nurses and our doctors will monitor them. Okay, make sure that they're all stable. But if we see a sign that they are actually getting worse or deteriorating, then we quickly refer them to the hospital.
Right. I think it's fair to say memanglah kita tak sihat, tapi just to stable, to make sure that stable. Nak kata suruh jadi sihat tu, it's a bit hard since you know you are a patient already. Correct. So just make sure stable lah at least kan. That's okay. Right. So doctor, thank you so much for all the info, the explanations, the answers. I'm sure it has benefited a lot of our viewers here today. So, having said that, Doctor, can you explain to our viewers, perhaps ramai yang baru first time dengar MAA Medicare Charitable Foundation. So, can you perhaps explain what does the MAA Medicare Charitable Foundation do?
Of course. Well, basically, MAA Medicare Charity Foundation has been established, like you mentioned just now, since 1994. So it started in a small shop lot doing dialysis. And then amazingly, we got very good response, and then it has expanded to even 11 centers. Okay, so majority of the time, our services are actually sponsored treatment for patients who are underprivileged to undergo high quality treatment of hemodialysis. Okay, and then the good thing is that we can either use sponsors for these patients, and we can also use donations, and donations come from the good hearts of all Malaysians, so they are the ones who donate to us, and this money is channeled into something called the Patient Welfare Fund, and whoever comes from the very, very poor margin, we will actually sponsor their dialysis. So in the market, dialysis per session is about 200 plus. So imagine 200 plus 3 times a week.
That's a lot of money.
That's a lot of money to spend, Okay, so we help these underprivileged patients, okay? And the amazing thing, it has expanded to 11 centers. We even have one in Kuching and one in Kota Kinabalu, all right? So Kuching is our biggest center, is its own building. We have a partner with Cik Mus, okay? And we have about 200 patients in Kuching alone. So those who have problems with finances, those who have problems with COVID-19 now, we try and help them to find affordable or sponsored dialysis treatments. And furthermore, if you notice, I think Dr. Nick also has met you last time. We were able to expand our services, not just to kidneys at the moment, but now we even opened a cardiac diagnostic center. Okay, so now we are trying to promote that as well. So again, affordable, sponsored diagnostic cardiac center for patients, and then we can even do up to 2 angioplasty here by renowned cardiologists in Malaysia. But otherwise, I think majority of our work is considered as amanah rakyat pada patient lah. So when they donate to us, we feel obligated that whatever money or funds are given to us is put to good use. So we use it for dialysis treatments, medications, EPO that you mentioned, that erythropoietin, that one is actually help the body to create red blood cells failure. And then we even help them to, for transport as well. And then with our partners, we have partners like what I mentioned in Kuching, or the one in Percham, with our PMA, and then Peter Moore in Kota Kinabalu. We collaborate certain events with our partners, and then we will actually gain donations in the sense of either money or let's say groceries that you mentioned just now.
Right.
Okay, so it's a very tight-knit collaboration with the people of Malaysia, with our partners, with our doctors, our nephrologists, our nurses, to ensure that we give them, despite it being sponsored, despite it being affordable, that these patients still get the best quality of care from our centers.
Right,
That's what
right.
we aim for.
That's amazing. Okay, so for those of you who wants to book an appointment, you can scroll to our comment section down below, and you can find us at our pin comment here. You can find our phone number. You can book your appointment. There's a phone number there, and also anything else, you can visit our website at www.maamedicare.org. And again, we are about to close our session today, but kita bagi Chan lagi share this live session, because we will be announcing the winners for the Deluxe Healthcare Package worth 290 ringgit for this week's session, and also last week punya juga nanti we will announce. So please share, and also visit our website, and then just Dr. kita nak take a few minutes just to scroll and read the comments. There you go. There's a comment from a viewer saying, thank you for the great info. I'm currently undergoing HD in MAA Kuching. Very grateful. Yes, amazing. Excellent. Great. And someone commented, well done. Thank you, Dr. Shazli. Thank you so much again. Yes. I believe that most of our viewers have benefited a lot from our session today. Again, thank you so much for being with us here today for the past beberapa minit dah kita berbincang.
Sorry, can I add a few things
sure,
as well?
Sure.
Just wanted to mention, right, for those who are interested to enroll in the dialysis centers, okay, usually you can actually approach any of our centers, 11 centers nationwide, and then you can actually get the application letter, the application form. So then the form will be filled up by the doctor, and then they will ask certain information about the family background. Okay, then they will submit the thing to me, and then we will actually go through, and then we will approve it. If the things all qualify, we'll approve for the dialysis sessions. Okay, so basically you can either contact us to the phone, email, WhatsApp, or physically come to the center, because you might want to see how the center looks like, and where is it. Then the form is all there, so they can apply for dialysis centers in our centers through that way. And then I've always want to remind everyone that kidney disease alone is actually caused by hypertension, it's caused by diabetes, okay, high cholesterol. So these are the things that's very, very common in Malaysia, okay. Mainly I think it's because of our delicious multiracial food, okay, that's available everywhere. All right, so please be aware that kidney disease may not be caused by COVID or by infection or by an accident, okay. It can be just because by your usual hypertension and diabetes and all that. So please make sure that everybody controls your food intake, monitor your sugars, monitor your body mass index and your weight, monitor your blood pressure, because when you control this, when you control all of this, you prevent kidney disease from happening. Okay, so I'm hoping that that message to everybody can listen.
Yes, that's really wholesome, doctor.
Yeah, so please do that. And then those with COVID-19, those with end-stage renal failure at the moment, I say low salt, low protein, good food control, and please get yourself vaccinated for COVID-19.
Yes, hopefully everyone will get vaccinated. And doctor, just curious, what are the age groups that you are currently treating usually?
At the moment, it's mostly 55 years old and above. Okay, we had our oldest patient is about 80 years old, okay, and our youngest patient, unfortunately, is about 24 years old.
Oh, very young.
24 is our youngest. We had one who was 19 years old, but sadly, she passed away, the 19 years old, okay? So 24 years old is also due to excessive use of painkillers.
Right.
Okay, so painkillers, if it's not used according to the dosage that's recommended, or use too long, because medications they have, let's say, or you can only use it for 1 week and then you stop it. So unfortunately, no one advised this patient accordingly. Use the painkiller at a very high dose for a long duration, and that painkiller itself damaged the kidneys. So she was 24. The painkiller was for migraines. So it was a sad story for her, but she's very strongly motivated. We always want to motivate our patients because majority of patients who have kidney disease on dialysis, majority of them are either stressed,
Yeah.
very emotional. Sometimes they get depression and things like that. So we want everyone to be motivated, to be so-called disciplined with their treatment. So for a 24-year-old to come every 3 times a week, 4 hours to stay here waiting for her turn for a kidney transplant, we don't want her to lose hope or lose motivation. So we want everybody to be at their highest mental capacity otherwise. Right?
Yes, that's right. That's true. Talking about mental capacity, kan, it's also important for everyone at this pandemic times to really keep their mental health checked too. Okay. So, all right then. So thank you so much again, Doctor, for that.
For having me.
Yeah, thank you so much. And we hope that all of you have benefited from this session. And again, walaupun dah habis live ni pun boleh just share and do like us, like our Facebook page. And also we hope to see all of you again, maybe more go live with doctor session with MAA Medicare Center. Okay, thank you so much, Doctor.
You're welcome. Take care.
Have a great weekend ahead. Stay safe.
Stay safe.
Bye-bye.
Bye.
Assalamualaikum.
Waalaikumsalam.